So below the knee, we are facing a lot of challenges. Patients with critical limb ischemia were showing up, have a lot of calcification within the vessels. So we definitely need to discuss how to treat calcified long lesions and definitely achieve a good lumen gain. Lumen gain is important for clinical improvement, and therefore atherectomy is a very good option. And we analyzed a combination therapy of IVUS plus atherectomy, and then followed by drug-coated balloon for these particular patients with BTK disease in critical limb ischemia. So the study design is a prospective, multi-center, single-arm study including 75 patients. Only including patients with Rutherford 4 and 5 situations, so we want to see the worst of the worst patients. Inclusion criteria are definitely solid BTK problems, so that we can learn how this combination therapy, IVUS guided atherectomy plus DCB, works in these patients. We had the first glimpse at our data analyzing 35 patients, and we showed the technical success of the combination therapy using atherectomy, IVUS guided plus DCB. So what we found out, as this study was core lab adjudicated, that angiography didn't show us the real lumen diameter. So reference vessel diameter was significantly different on IVUS to angio. And having said that, we decided in all the cases then on IVUS the size of the balloon, the DCB balloon. And we hopefully then want to see that the lumen gain and respectively clinical outcome in these patients based on this IVUS guided balloon diameter decision then helps to improve the clinical outcome in these patients. So far, with this very interim data, I can say IVUS guidance is helpful because it gives you much more information than angio. It gives you more information about the lesion. It gives you more about information about dissection, post-angioplasty. It gives you more information if persistent restenotic problems are still there and need to be treated. This is a pilot study. So the next step would be after that study definitely to do a randomized trial, IVUS guided therapy versus angio guided therapy. So this can clearly then work out in endpoints, clinical outcome endpoints, if IVUS is a real definitely helpful tool to treat CLI patients.